Good morning. Good morning. This is Engineer Suraj Singh speaking from Bharat, India on this day, May 12, 2021, Wednesday. And I'm happy to see you again. Yesterday I had a talk, but that was disturbed due to technical reasons. Title of today is same, COVID-19, Civil Field Engineering, COVID-19 Designs, Construction Methods, Contracts, AnnexSL, Organization, Quality, etc., 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 as usual, and top priority is given to COVID as well as quality. You can see that. It's not very something special. You can see the certificate, membership, fellow, the certificate of Chartered Engineer, India, Bharat. This is just for information that my identity is that. Then you have to see various issues and you have to think of that. And we have to do, I close these files just for reference. I showed to you, and I close these files also. I keep some files are open. I'll talk about quality. I'll talk about COVID. I'll talk about issues of COVID. I will talk about further publications, and I shall talk about various other issues. I put on later in these files which I have here. These files you can say, I can see these files, building design concepts and detailed engineering, like that. We'll discuss about this issue. Let me start with this, how to handle COVID and how to handle people outcomes. So as I said yesterday, there was some disturbance. So I'm starting here. Let us start with quality everywhere. Quality is a must in life, we know that. Quality, if we don't maintain, we can't maintain anything. And because we are engineers, it's our responsibility, basic responsibility, to look after quality. And if we look after quality, this means we look after quantity. I am finding not very interested people in the engineering community who talk of quality, who talk of issues. They talk of only formula, they talk of only designs, and they forget that design is also a part of quality. If they don't do quality design, work cannot be done, and that's an important part of that. If we don't care of quality, means our product is useless, because it's true that design engineers don't work on sites, but that's also a fact that site people, they depend on designs, and if designs are excellent and they don't improve quality system on site, and all those engineers who work in designs, they don't link themselves to quality production site. This means there exists no proportional relation between quality of design and quality of work. Quality of work means design is achieved, and if quality of work says no, it is not done, means design is not achieved, and everything goes waste, I can say, in that case. It's very important point. You have to understand this simple relation between quality and design, and quality in design and quality in construction, both are important. And because it happens we did not happen. If you go back to COVID-19 issue, that we can say COVID-19 issue here, which is it's an issue of health, safety and environment. Health, safety, I always consider with health and safety, because it is health issue. People are sick. We have to understand that it's part of engineering. It can't be denied. It means okay, it's something new. It means we did not have this sickness before. It's okay, fine, but it's health issue. I'm number one to say that HSE is priority subject. HSE is priority discipline. If we forget this, if we ignore this, we ignore ourselves. It's issue of engineering, very much engineering. When we start some site, we take care of HSE first. If we don't take care of HSE, no one can enter site, no one can enter project. That's fine, we have to understand that point. We have to enter project, we have to inline to compliance of HSE, which is called health, safety, environment. And of course ergonomics is there. Ergonomics support workers, crew handling. We have to take its care. Now all this health, safety, environment, ergonomics, support, workers, crew handling, all that we have to discuss. It's very much part of engineering. If we don't care about this means we don't care about ourselves, we don't care about people, we don't care about human, we don't care about the sites, we don't care about ultimately engineering and engineering society, engineering world, engineering existence. So we have to consider health, safety, environment, and this support should go from ergonomics. Ergonomics, what is ergonomics actually? In fact, if we consider ergonomics, it's very very wide term. It applies to world of engineering, not only to world of engineering, but to world of society. I understand this, how to use your energy best way, how to use your energy optimum way is ergonomics. Means you have energy, you are human being, you work, you do whatever you think, even if you think it's work. So ergonomics, that energy, is that quantum of energy which we employ in our work. We draw energy from our body, our mind and work. And that energy is dissipated in our body and work. Now what way should be dissipated? That's the question. If my energy is used properly, optimally, I will be happy. But okay, I had this energy, I walked 5 kilometers, I spent my energy on body and I released my energy from body, which is residual energy. And I also got energy from air. That's what I feel. And so walking is best exercise. Similarly, work is best exercise. If you work using my mind and using my power of thinking, I say, I've done it. And I say, I have solved this problem, I solved this numerical. There was a problem, I tried to understand problem, analyze it, and I reached solution. I feel happy and everybody feels that. So ergonomics is that part of science. You have to understand as this is applied as support to workers. And I'm also a worker, you are a worker, everybody is a worker. Whatever level you have, it's work after you to do, mental work or physical work, or what is sort of what semi-mental or semi-physical. Crew handling is very important because I'm also a part of crew. Every worker is a part of crew. Every manager is part of crew. Every person is a part of crew. Crew means a group of people who work together within certain limits. Is that crew means they have one object, and the object is achievement of activity of project. That's called crew. Means if I am flying, it's called flying crew. On site, it's called site crew. A group of people, you can say, who have same objective of handling. So we have to relate to COVID-19 powerful attacker which is onto our world and to our country. We have to understand that. If our people are infected or they may be prone to infection, should we not take care thereof? There's a point here. We cannot simply say that, no, I should not take care of it. It's not my job. I'm not a medical person. Yes, I'm not a medical person. But I'm pushing them to that way. How to handle COVID, that's a part of problem. I'll come to that. And first, let me just brief you about what's happening in our country in COVID-19 exercise. And because it's a very important part of health, safety, and environment and ergonomics, I have to talk to my workers. Before that, briefly, I'm going to explain to you what's happening here, what I'm doing on support society. I know COVID-19 is a powerful attacker. It's attacked us. 50% of world infections are doing in India. They're working in India. It's a statistical report, world report. How many infections are happening? Half of them are in our country. And you can say officially every day we are seeing around 4 lakhs, 400,000. This was 800,000 working around. This last thing. This official figure I'm giving you, but I'm not happy with that. It's much more. No problem. I'm not talking that one now. Now I say medicines is very important. That's okay. Medicine should be given to everyone. It's not only medicine here, infections. It's medicine everywhere. So what is medicine? Medicine that you can say replenishes any deficiency requirement in body. If I have some part not working in my body, if I have some problem, you have some, you can say sickness, temporarily I take some medicine to replenish that lost energy which I have. So it is called medicine. No, what I say means, let me just blow it up. Yeah. Says then one say that COVID-19 powerful attacker and 50% world infections in India, medicines, etc. Yesterday I talked a lot on this, but it could not be recorded properly. That's unfortunate. Now India is in trouble. It's in trouble. Data issues are significant. I'm not criticizing anyone, but data that we are getting is you can say not independent data, I can say, because it's published by government, and government tries to fabricate data. Every government tries. USA tried, England tried, France tried, Russia tried, Europe tried, China tried. I don't think there's any country, there's some country left which did not try to play with data. It happened in past, not very past, just a couple of months back. And we are also doing same thing. We are no different. We are not Satyavadi Harishchandra. We have no energy to claim that. Yes. We have no guts to claim that actually data should be correct. Data tells us what you have to do. And if others did this, should we do that? That's question mark. This means we are not helping world, we are not helping ourselves, we are not helping people. Because data is a teacher, data is an indicator. It should tell us where we stand. If you stand, data issues are significant. Now data not only for infections or you can say for death. Not only that data, even data of supports, data of oxygen, data for hospitals, data for requirements, data for beds not available at all. We don't know how many beds are available. Public doesn't know it. How many hospitals are available, how many they can accommodate, how many patients, what is the status of oxygen, short in supply or not short in supply, or short in distribution or short in manufacturing. What's the status of hospitals, how many hospitals are there, how many beds are there, or how many beds can be added, how many are required. There's no data available at all. And that's unfortunate. How many doctors are available, that is register can tell that, that's okay, but are they adequate enough? Numbers are adequate enough? Our nurses are same adequacy? No, it's not. Ventilators and infections you say government says 329,000. Sometimes they say 366,000. Sometimes say, if you see a file here, I like to show you. First we'll go to there, place and see if I can see here. There's a file here, so you can see the file I published on Facebook, and this is. This file is for don't go to this file is for data of 10th of May 10th, and published on 11th May. This file gives you complete data. Here is this, here is something is written here. You can see that it's not miraculous. In fact, this is data analysis, call it an extremely bad status of testing and vaccination. It is in Bharat, India, and I say government sleeping, people of Bharat sleeping. Government's inefficient, people of Bharat, India are inefficient. I say government drastically failed to handle this data. It's not an attack actually. It's no attack. It's just factual statement. I'm just giving my study analysis. As governments are not interested in testing whole population, that's a fact. And no actions, I can say no actions, no government policy. States based on government of India report, and it's no seriousness in our country. Sleeping status continues because we are sleeping in society. That's very much factual, that we are sleeping society. You should not be, but we are. And if you say that from reference, this is reference to this, many of these items, 5 items, particularly these 5 or more items, I've taken from mygovernment.in COVID-19, and of course, so that it's nothing my personal. Now it's not from some sources, for reliable source, and this official source of government. And you can see now columns are days, numbers, and report day. Remark population indicative only. I'm taking 130 crores people or 39 million people. You can take it 135 or 830 or anything. So data will vary. And percentage they tests done in relation to population, you can say it's very small percentage of they can say it's in their points. It's very considerable. Means they are able to test. They are not able to test their people. We are not able to test our people. Unfortunately, it is total test updates. This is, and then percentage total test done, and according to the population, and percentage remaining. This total number of tests we done, and daily tests we do, and this is total number of tests which are remaining to be done, and this is daily test conducted number of tests, and daily percentage of daily tests over total tests, and infection update. This is like that. I have given information percentage of positive infections to total tests done, and daily positive cases and daily positive percentage tested, and daily updates, and like this I have there. Then I'm using some other formula also, which I'll tell you later on why I'm doing that. There is I'm taking 2.5 here times what government publishes. This means I don't trust government data. That's very fact, because all countries did that. So whatever data government is publishing, I just take multiplying factor of 2.5. It can be 3, it can be 4. It depends upon. I just try to take middle path, not to take a 1 and not to take 5, but to take 2.5, an average one, so that it's neither illogical not logical. Both are there. I'm trying to show what are facts, so that facts must be clearly shown to everybody, and that's very why this is the report dated up to, you can see this report is up to 11th May 2021. This is 234 days report here. 437 days are there now, and it says here this in this column you can say on May 5th or 10th there were 30.37 crores tests done, individuals done, and on 11th May 30.56 crores individual were totally tested. So I'm just taking this data in consonance of this, and if you say 23.508% of people were tested till yesterday, that is till 30th, till 11th May 11th. 23.508 people were tested, percentage of people were tested, and before that 23.365. You can see difference is very small. If you say here it's just 0.142%, 0.113%, 0. So you can say you can't test even 0.5% people in a day. It's unfortunate. And you can say here 76.492% people are remaining. Here also 76.63% seem to remain there. And here you can say here 14 lakhs people were tested according to numbers on this day, and here again 18 lakhs they are showing. Means still your people are not tested. If you see past results, 18 and 15, go back and see. Means your capacity of 130 crore people is only this. This is only 0.142% daily. I don't understand what sort of people we are. Can't we test at least 1 crore people a day? 18 lakhs, 14 lakhs, we have no capacity to test 18, only 18, 14, 15, 10 we test. Why? And you can see then total number of infections, 20 times 20, let us say 23 crores, 22.66 crores here, 22.2. Only out of 130 crores we have reached only here, which is very much troubling to me. We can't do. And you can say here total number of positives they declared each day. They declared yesterday it was for 11th May, and it was 3.29 lakhs, 3.3 lakhs, before that 3.66 lakhs, before that 4 lakhs. Means they are trying to adjust. How it is possible? People, you are not testing and you are saying you are down. Means you are not down. You are down only to an extent of 23%, not more than that. Here you do not know what happened, how many people are here who may be impacted. So this figure is completely misleading, I can say. This 22.99 you tested, they are saying they are only 3.2. I can say no, it's more, much more than that. That's why I'm taking a coefficient of 2.5 to multiply this. And same way, last time it was 24.83% positive of those tested, and it's now again 17.6. In one day there can be 6%, 7% difference down. It's not possible. You can't say in one day this is 75. It was 21.44. It came up to 22.68. Then it came up to 22.18. Then 21.64. It's rising. You can say marginally falling or rising. It's heavy for us. 21.64 to 24.83. It's heavy rise. How can you say in that case that you are doing better? No, you are not doing better. It is somewhere wrong. 24 to 17, a drop of 7% in a day is not possible. It's not possible. Unfortunately, it is something wrong somewhere. These people are not conducting any analysis. Dead bodies are floating in rivers. People are not getting treatments. There's no place in cremation grounds. There's no place in graveyards. There is hue and cry everywhere. Oxygen is not available. People are dying because of shortage of oxygen. And you say we are down. This is completely misleading. So here is what I say. This is important to understand. They are giving total number of dead bodies. If you see only, you can say vaccination is also not clearly done. You can see variation data. This is completely, you can say, it says 13.285% vaccinations have been so far. 13.285 since 16th January 2021. You have no base, no regular base for vaccination also. And if this condition moves on, this state of vaccination goes on, it shall be 96 days you require, or you can say 900 days you require to vaccinate public, and which is troubling to hear. You can say it's a must to avoid explosion by adding additional resources. That's a point to very of concern. Additional resources. Well, I can't say about that. How additional resources? We have to bring up additional resources, and this is very much troubling. You could not pull resources till now. How do you expect resources you can bring in? It's my question. So again I say, it's a must to avoid explosion by adding additional resources, but we don't have resources. We are fighting together, political fighting. Death probability is 28.11 crores according to this data. This means millions of people have died till now. World energy, world experts already have told this. The more than a million people have died in this country till now. If you take last 4 days, percentage of daily positive percentage last 4 days, it says yesterday it was 17.83%, yesterday or before yesterday I can say, before that it was 24.83, before that 21.64, and before that 22.18. So average people who were tested positive was 28.11. Still it is 21.62%. I'm sorry, 21.62% in last 4 days. I am taking 4 days. Okay, let us just assess. This means about 28 crore people have been affected. This is positively affected, means 28 crore people are still in infection, which we don't want to explain, which we don't want to accept this fact, and I multiplied with this 2.5 factor. Actual daily cases is 8 million, 8 million, 8 lakhs, 8 lakhs. Actual daily cases is 8 lakhs, you may say 1 million, better, just on average. Then actual total real deaths could be more than around 6 lakhs, 6 or 6.25 lakhs. This is I use factor 2.5, and here actual daily deaths is 9697. That is 10,000 days, 10,000 deaths happening every day. This is very much troubling, and this is very much troubling. And I can say, if you go to this matrix here, you will find, I say that now it is 437 days since March 2020, and this is our result. And this result, now question is, can we wait for all days? That's a question mark. Each day since 1/3/2020, it's 437 days, and average people tested is only daily this much, which is not correct. And we have to see how many, 975 days. We need more for testing, which is not going to happen. 975 days or 1000 days, you can say. Can you wait for testing? Actually, there is no plan for testing. There is no plan for vaccination, unfortunately. Where I am taking one vaccinations, you are doing 90% I am taking for first injection, and 10% I am taking for second injection. And this is total answer here, that we started on 16 January 2021, and we had, this is for that day injected 2.25 lakhs we injected yesterday, that is on, you can say, on 10th May, and total for 14.24, and here total is 17.27 crores. It's nothing if you compare to 130 crores. It's nothing. In fact, total percentage is 13.285, all these injections, and it's 11th May report. So you can say you need 3 years more around for purpose of you can say 2.6 for possible testing people. Now we'll go to graphics here further. You can see this graphics here. This is number one graph. This is Bharat India daily, and that's positive since you can see where it was and where do we are now. Where do we stand now? You can see here this graph moves is very low. If it moves like this, you can see it's already available on the, if you see it's high now, it has crossed 4 lakhs. Of course it's down now according to the report, but if this 4 lakhs, if I say no, it's not 4 lakhs, it's 1 million, so it will go somewhere here. That's the main point we have to understand. Then it's also, if you see number 2 graph, which is test conducted, you can see this is how this curve is moving. You can see this, the profile of this curve like that. You can understand this is non-professional curve. It should be actually like that. It should be, or it should be like that, but it's not. It's still we are in this range. Means you could not test more than here. Means very very low profile test. Means we could not even cross our people, and we could not do more than here. So daily test, this is no uniformity, and you can see here this is Bharat India positive cases in April May. You can see it was here in 1st April, and you see how it goes up. April has mounted it. It's steep mount. And now they are saying it's falling, but that could be anything. I'm just giving information. And here it is positive cases April May, then it is you can say here Bharat India April May 2000 deaths. If you see, you can see there was only 459 somewhere in April 1st, and it's going down to now. It is generally said that already 10,000 people die every day. They are giving 3,800, 4,000 something. So we just inform you what's happening. If you see vaccination, you can see profile. It's rubbish. You can see this is the status of vaccination here. There is no angle. It's like if some child makes an art. It's that I am making some mountains talking to sky. You may say there is all cliffs of mountain. These are valleys and downhills. So it's like non-uniform teeth. It's like instrument profile. See what we are talking of. We cannot have a profile like that for testing. We don't have. So what we have? Nothing. So we can go further up and this okay. We go here. This is another profile, and same way you can see this. This is another profile for COVID-19 cases, and same way this is for May, April, May in cases, and just for clearance, the 2 months I have shown number of cases that was complete total, and now it is infected to percentage of infection. You can see percent of infection. It's somewhere here. Then we go 25% here. This is infection percentages, and also then you can say here Bharat India total test done. Total test is a cumulative sum, so it's not something else. Now COVID since 24/5, this is percentage infected since 25 Apple, you can see 20.34 here, 25.17 here, 19, then 20, and like that is going. So we can say proportional line here, which may say 20 to 22 or 23% average people are infected. Yesterday this was 17. I don't accept that, because we have to take only 22% people are infected. This means 20%, 22% means you can say about 28 to 30 crore people are infected. That's what it says. And daily actual assessment is here. This is just for daily, and this is of course here is another curve which is all saying that. So this is just for information. I try to give you these curves because this data which is very very important one, and I say where it's gone. Hold on please. This is my trial to you to show you this file. You can browse this file clearly and you can see how I worked on this. This is data of 234 days, and this is reasonable data. I can say nothing wrong with this data, and you may say 31 crore people I think they are infected. 31 crore people according to my assessment, maybe 35 crore. It's not only this, so I put this file off. Let me open this on the file also and go through that before we close this, because that's also an important one. And this is a report which I gave yesterday. This was a report published, and the yesterday's report was not clear. The report is same except this data. This is 329,942 cases. Yesterday on 11th May publication, it was 366 something before that. So this is 234 days data here. Analytic information for May 10th status and May 11th publication, and the worksheet I have shown to you. Now this is, I say fatalities or deaths being reported amount to at least 2, an extent of 40% only, and absolutely fake figures are being published by fake figures, or you can say fabricated one, just to keep people down, just to let people believe that it is in control while it is not in control. So this is 40% only. Then we can say May 11th is reported day and effective day is 10th here, and I say following data has been included based on Government of India portal based information, which includes only those individuals that have been admitted to hospitals in private as well as public or recorded otherwise. And of course there are Saturdays and Sundays and holidays and some other days where reduction data is reported, or they artificially create data pertinent those who were located at home are not recorded and lost their lives elsewhere due to COVID-19 is not included herein. Bharat India has officially crossed daily cases of this on this day, 10th May, and I can say inefficient. I'm not blaming some person, but organizers of data management and COVID management. And we say, I understand 50% people in cities have been infected, 50% on an average, because it's like community spread now. It's not only spread, community spread it is. And we are being befooled by telling that we are in control. And world is worried, we also worried inside, but we don't want to speak truth. And it's health issue, we can't hide. So this is the publication. So I'm just saying my point in this is I'm not blaming failure of nation, the failure of nation, and we should not be misled by anything. And despite vaccination, one requires to undergo resorting to entities and tap precautionary measures, which PPEs, etc. Eyeglasses are very important because we have to protect our eyes. Otherwise, this is an easy route for this virus to enter into our body. There is no plan for vaccines, no schedule, nothing, no plans for vaccination, no plans for testing. And US on an average till now is only figure. Can you believe it? They say in 25 lakhs, sometimes 13 lakhs, but if it's the average of first dose and second dose, it is that much only. Only 14 lakhs, or you may say 15 lakhs, let us give some concession. 15 lakhs per day is not nothing. It should be at least 1.25 crores a day. And if you take both cases, both stage 1 and stage 2, then it should be 2 crores a day. Can you imagine? Can't we do that? We are not doing that. There are so many reasons. Vaccines are not available. This means we did not plan anything before. We have no engineer there to plan, no expert there to plan. And that's a fact. Each day we should have for 142, which is 1.42 crores for dose 1 and for dose 2 with a gap of 4 weeks. This should be a requirement. This is requirement, and with what speed we are going, it will take 896 days currently up to latest data, 896 per day. 896 days, and you can imagine 900 days for vaccination. We shall all die by that time. So we can say now Bharat India is in complete problem. This variant has come and it is going to other worlds also, other parts of the world. So it has spread to more than 100 countries. And this is the world state of what UK is happening, what is happening. Scientists are naming it, and inoculation of vaccines. UN is very unhappy. And our status is that only 17.27 crores vaccinations done so far till May 10th, and this is 11.5997% for number 1 and 1.329 for number 2, and I am taking 90% and 10% respectively for both doses, and can be said extremely slow speed. No, there is no schedule, there is no meaning of talking of that. We are not doing this, so there is no meaning of talking of that. We have failed, and because population tested so far is that is only minimum, and 76 to 77 crore, 77% people still not tested, and we have passed 436 days. Then these people are poor actually, and they can't afford their testing. They depend on government, and government doesn't do any initiative for that. And whatever the information they are giving, many of them have been repeatedly tested. So 23.508% test done so far. Out of this, maybe 1.5 those who again and again test. So you can say 20% to 22% only have been tested so far. This means we are laughing stock. We are, yes, because we cannot test our people. How to know remaining population is safe? So it will take more than 3 years, and we can wait for 3 years. That's not my. I can't answer this. What's happening in the world? You can see all this is here. I don't want to take time on this, and it's very undue, you can say, unbecoming of facts of our country. On 11th May is this, that our cases are happening and vaccination started, but only 17.27 crores vaccination inoculated, and that is 13.285% total, and that is for both cases, stage 1 and dose 1 and dose 2. And you can say total tests conducted is 30.56 crores. Tests conducted on 10th, that is latest data, which is 18.5 lakhs. Total corona infections 22.9 or 23 crores, you can say. 230 million, may say 230 million corona infections reported, and positive infections, that is on this day is 3.3 lakhs. This is of course played data, so I'm not arguing on that. And personnel was tested and declared positive 17.83%, which is 23.184 crores. If you apply on to whole population this data, it every day changes depending on how many percent people are infected, and that is, you can say, so far 2.5 million and 2.5 lakhs they say, or 0.25 lakhs, 0.25 million, but experts from various parts of world say already we have crossed 1 million death mark, and next month or within 2-3 months we will get more than 1 million deaths. Population tested is this much and remaining population is this much, you can say 24 to 76 ratio, and time required for testing 975 days, and you can say actually suspect is this by 2. If you multiply by 2.5, you'll get so many people infected, you can say yesterday. According to this data 2.5, it could be more. Let us say on average 1 million people infecting every day, 1 million people, and that's 10,000 per day on an average, and that's what I say. And you can say total that so far is, according to this calculation, 624,980, which is 0.6 million, but experts say it's around 1 million. Well, just it's a speculation as far as non-data is concerned. As far as application of 2.5 multiplication factor is concerned, this speculation. Now what you have to do not depend on government because it has failed. Then yes, vaccinations are not available, book for it and try, you can get it maybe. And above 45, there are sort of policies here government has decided, and this Mel, I'm just referring to what's happening, and you have to do that. We have to think very seriously in this case, and these vaccines are only for your safety, not for treatment, but for precautionary measures application safety, and PPEs you have to wear, don't run away, and possible magnitude of risk must be understood or evaluated by analyzing its power. So this is what I say. For other countries what's happening, you can read, their file is available, you can read there on Facebook. I'm just giving you something. And all the Bharat, we say 23 crores we have crossed infections. Again, it's a summary, and so many people have been tested, only 30 crores and 23%. So it's no worry for COVID-19 status. No plans are available for remaining people testing. No plans, in fact, no plans. There should be a concrete schedule we don't have for all these. And just to avoid its powerful explosion, only that we should test all that could cause lives directly and many crores additionally infected, and also to give post-discharge care which must be required 6 months later. Nothing has happened. Then it says many discharged patients have reported back their infection around the world, which included post-discharge care, but this aspect has been condoned by government. So, it says that it has been observed that more than 56% of those discharged after formal treatment or formal allowance of hospitalization did recontract symptoms of COVID-19 one way or other. Since 56% people report again. Testing is very non-conclusive, extremely unsatisfactory, which means no plan can be charted out. So inoculation plans are same status. So future of ours cannot be correctly either forecast or predicted in absence of plans. No change or accelerating programs, can say here. And then, in fact, you can see this. What I'm trying to say is that performance is to be improved. No clear signals. Government is not worried about poor. That's what it says. Sufferers are poor, not rich. They can spend money. There exists no government, in fact. No government policy towards public handling of COVID-19, and that's a serious issue. And poor have to depend on themselves. You spend on your money, 1200 to 2,400 for testing. If it's possible, then you have to keep someone with you. You have to isolate yourself. You have to buy protocol medicines, and all this you have to do. You can't do. You have to comfort me due to inefficiency and sleeping attitude of government. It's lethargic one. COVID-19 shall certainly explode in Bharat, India in form of COVID-19. But we have to see a society that remains non-serious, which we are, can't do anything. So these are all certain points. I'm not going to read them again. This is government site copied from this site. This is status, and you can see here they are showing only this figure, important one for me, and then these are URLs. But I always copy my URLs. I put my file of Excel on script.com. This is that number, and put in this also daily numbers of infections. And same way on facebook.com I can link it to, and I also link to LinkedIn. I'm not given here, and also on Facebook. So you can say these points are available here just for your reference. I'm not closing this file. We'll talk something else, and I close this file also. We'll talk something else. Now I'm talking about what we are doing. COVID PDF is very important part here. We need to understand what is that. I was talking about health and safety of our people. Health and safety of people, which is a very important part. And I also open file which is related to this. Let me see if I had quality, COVID building design concept, and detailed engineering also. I can say detailed engineering, which is also here, because yesterday I missed these files. And I have to take care of now about these files. So before going further, I like to hear. I could not get benefit that day. So my question is about health, safety, environment, ergonomics. Because I'm worried about executive engineering. Executive engineering means we have to think of execution. Life has changed, drastically changed, thoroughly changed, and it shall continue like this. My prediction is that in our country, up to December this year, December 2021, it's going to be very horrific. Government may say anything, they may try to play with data, but they cannot play with COVID-19, which is unknown till now. What's its origin, how it's working, we do not know. No scientist in the world knows that. When no scientist in the world knows that, we have to assume that this is a natural application, natural impact, and God wants to teach us. Now my question is not that you don't go to marriages, that's already I've told. I've done everything about that. Now my question is about engineering and society. We talk of health, we talk of safety, we talk of environment. These are very important issues, and we usually call, if you don't take care of health, you don't take care of safety, you shall meet accident. Certain, for sure. You don't take care of environment, you will meet bad air, polluted water, and it is. Everywhere you see pollution, plastic pollution, or you can say septic pollution, or you can say absence or depletion of oxygen from air, or you can say that ultraviolet layers, or you can say ozone layer around our solar system is also degraded. And we generally used to call term greenhouse gases for all this. That is scientific term. I'm not going to say something. My question is on ground. When I work, my people work, say, I'm an engineer, you may be an engineer or non-engineer or other professional. You are maybe people, you're having people. People are working in hospitals, people are working on sites, people are working on roads, people are working everywhere, in factories, in industries, in production, whatever, where, whichever field they are working in. They're all human beings. They must have good health. Safety, they must have. Health, they must have. Surrounding environment, they must have sound one. And they should work according to requirement, according to best use of their energy. That is the basics of safety. It's not subject for nomenclature's sake. Health, safety and environment with working ergonomical formula or shapes or directions must be used as support. We have to take care of our workers, our crew handling must be there. But now we used to have so much about this. We have to conduct talks, we have to conduct training speeches, training lectures for these subjects, health, safety, environment. It's because all classes of workers from lowest to highest managers all must be safe, all must be handling personal, should take care of their crews. Now, COVID-19 has changed the whole scene. They say you have to wear mask, you have to wear all PPEs, you have to keep safe distance. They call it social distancing. I would say it is social distance as well as it is working distance. What about work? Okay, in factory you have to work mechanically or electronically. There is always distance. In offices people work with worktop stations, workstations. They can maintain safe distance of 1 meter or 2 meter, whatever is logical and reasonable. That's okay. My point is not that, because there is a standardization, but when you come into field of construction, civil particularly, wherever you work on any development project, any infrastructure project whatsoever, you think just PPE is enough? PPE they already use. Every worker uses PPE, every worker uses safety shoes, safety helmet or safety hard hat, goggles, and also they use their aprons, or we call them overalls or gloves. They use gloves, steel workers and those who work on heat. All safety means they use. It's nothing new for them. When they work in cold work or in hot work, in certain operation area, they work according to rules of that area. That's not a question here. That's not a question mark here. Question is something else. Question is 70% of workers or 50% of total working force work in development works, or you can say field of civil engineering. My question to whole community is, whole engineering community as well as other communities, now situation has changed. How to keep your people under control? Those construction people, construction workers, they must be held to different requirement. We have to keep them healthy, we have to keep them safe, and we have to keep them to think to pro-environmental activity and to extract best output out of energy they spend on activities, which is called, we can say, just we say, ergonomics means when I sitting, suppose I'm sitting now in chair, I'm talking to you through video, there's some laptop here. Now what difference in level should be between my eyes, collimation line and laptop? It should be at obtuse angle, or should be at acute angle, or it should be orthogonal. That point, what height my chair should have, and how far should I sit from my laptop screen? These points are required geometrically, especially because I can't impact my eyes, I can't impact my body, I can't impact my legs for long continuous sitting. Say I sit for 3 hours, 4 hours, 5 hours, I should not get unnecessary strain. It's one point. It works with everybody. If you are working in a factory, standing position or sitting position, how or you want to bow before, you want to take yawning, how safe you are, how far should you from machine you are working in. All these points require concentration, require deliberation, and in construction engineering, when people work in heat, they work in rain also, they work in adverse conditions of weather, how they should work, that's a point of concern. That point of concern is very much important here, that we are concentrating on. So we have to see that point here for COVID requirement. When we say oxygen is required from air also. Hospitals are required, yes, hospitals are required in local vicinity also. We can't leave them, oh maybe something happens, some accident happens. Where is that ambulance, where is that hospital or nursing home? Is something there we have to keep in mind. Then okay, I'm not going to this. Now what I'm saying is, now we could not think of before, we used to think of only work. My workers should give output, maximum output. This should be my output daily, from mason, from carpenter, from steel fixer, from welder, like that. We have our points for production, and we stress everyone for that. Now, two masons work, or you can say when there is pouring of concrete through mobile pump or through stationary pump, people hold pipe at end of disposal, and many people stand there 4, 5 sometimes, because outlet pressure in boom is very high, and we cannot freely discharge that green concrete onto formwork. If we freely discharge, it will segregate, it will go here and there, and that's not permissible. If we are doing column, we have to concentrate on that accordingly. We have to take boom down up to 1.5 meter at least below, and same thing we have to do for slabs or beams or whatever work you are doing. This one person cannot hold it. You need 3-4 persons to hold that boom, discharge boom outlet, and control it. This means these people are very close to each other. Even if they are 1 meter away, there is a risk of COVID. And when they are very sad or very tired, they don't want to use mask. It's also practically difficult when you are sweating in hot to 35 degrees Celsius. It's hot. You force them to use mask, and they can't breathe in that situation. My point is, should we think on that or we should not think on that? Because there are chances that these people may infect each other, though they have a higher immunity factor because they are workers, physical workers. It's not only for concrete gang, it's also for other activities like block work, like brick work, and like all finishing activities, all structural activities, form work activities, steel fixing activities. These people sit together to an extent possible so that efficiency is higher. And that is my point of concern, because concrete is very important activity, and all other activities, road work, all that, where people sit together and work. Can we force them to wear mask? Yes, Googles they can use, that's important one. But in cold countries there is no problem. They can use mask in cold countries or cold weather conditions, but in hot weather conditions or warm conditions, it's really question to understand what Can we replace this with, or what's the other way around? That point we have to understand. Just like we say in concrete, there should be no flash setting, there should be no cold joint. Same way, there should be no flash nose, there should be no flowing nose, and people should not sneeze, people should not cough there. These are point, because that aerosol can come out from one and go to other one. Aerosols can come out and go to other one. So there is direct chance of infection. They drink water, cold water in that condition, and which of course is required because they are very hot, high temperature they have. Temperature means sweating, and if you ask them to drink hot water, this is not sensible. They will drink cold water, and when outside temperature is 40 degrees and they work in that, and they cold water, this is about 20 degrees or 15 degrees Celsius. It's the difference of 20 to 25 degrees, and which is dangerous, which can create coughing stays in them or sneezing stays in them. This coughing or sneezing both can result in infection. That's why we have to understand. We have to discuss things like that, means it's a part of safety, how to handle people for certain activities. Concreting is very much difficult activity, very time consuming, it's a continuous operation, and it's very much hard working operation. We cannot simply say no. We have to understand. And of course, you block places, and those who are working even indoors and finishing, all are subject to that. And they are not one person actually. There's no one person. People work in group. And wherever you think there's a risk, take care. And if they can't use a mask, but they are forced to use mask, and that can we organize like that? Can we accept output difference because every 5-10 minutes the person remove masks? And that's questionable. Even people talking on mobiles, I see when they talk, they remove mask. But that is dangerous. And they want to remove it because they can't talk with a mask. And even if you remove for 5 minutes or 10 minutes, that chances are infected. These points I want to concentrate on for construction activity field, and it applies to everybody. It's not to you, to me, but to everyone. That's why I'm very much concerned about health safety, and it's on every location, it's on every activity, mechanical activity, you're working, duct working, duct, and you're sitting together, erecting it, you're fabricating it, and also you can say electrical people, maybe they are not that much crowded, but civil people are crowded. They go to some cleaners, go to sewer line, and they clean it. What measures we should take? And also those, we can talk of ourselves if we sit in office. It's easy to work in office. You can distance yourself, but where your efforts would go, they go to site, go to construction. So you have to take care of people in each and every way. That's why this COVID is a question mark, because if they fall sick, they have to be exposed to same situation of shortage of oxygen, shortage of hospital, shortage of beds, demands. All these would continue until we realize, even if they are required to be isolated, shall they survive? Shall we survive? That's point here we have to think of. And it's not simple thinking in isolation. It's thinking in reality. This is the reality of life. So we have to take care, and this also called, you can say, a quality issue. We have to create quality in performance. We simply cannot say work is quality. Status of people working on activities must also have status of quality, and that's, we can say, quality everywhere. System quality, individual quality, element quality, product quality, others, design, and construction, which I'm talking of. Designers have to look also into this, though they are not directly related to site work, yet they have to think of. And method statements they have to give for every activity, time and again. That point cannot be changed. And of course, now we are to impose these activities restrictions, so time may be more required, more time may be needed, many fractions, of course, cost may be affected, and we have to exert more risks because more attacks are expected, and we have to reliability whether we achieve it or we don't achieve it. For that we have to conduct analysis for every activity. That analysis, are we conducting or not that? Then we have to find solutions through analysis and fit in and link each solution to the other. And then thinking, contemplation, and always at these points we should understand very well, or we cannot do justice to ourselves. Good morning, Mr. Verma. Thank you very much. And that point is very important that I say. And you may say that we were talking of this file yesterday. Other file also I was talking of, but I missed that one. And that file is also very important here. This was detailed engineering requirements, and that is here in this. We try to do all this translate analysis, and this all piping we did, philosophies. Then also you can say we could not do it correctly the last time because of many issues. So I try to find that file again if I can. The problem is that I face so many files I open. I miss many files, and that's really sometimes an issue of refining it. You open so many files, you find problem and refind it. And that refining is question here now. I'll try to see if I can find that one. Not able to open that, so I go back to my I'm trying to find file again. Sometimes it happens that it doesn't work. My God. Interface management, that is a file here. I find it now. And of course this I tried yesterday, I could not complete because it missed. And then also we have here EQ management tool of site engineers. I open it again. It's better to rewind it. When I'm saying his file here, tool of site engineers and interface management, as well as you can say building designs and contracts. I close other files. I think a quality file, let it open now. So many files are open now. What I'm saying is, let me say to interface management, which you're talking yesterday. In this case, I was talked about a interface. How do we interface our activities, our activities that are conducted by personnel or staff, and activities that are conducted by crew or workers, physical workers. That is very important point. Though this actually interface applies to different engineering, used to apply to other engineerings, electrical, mechanical, or you can say electronics, or many other that kind of activities, machineries, etc. But civil construction interfaces we are talking of, in fact, I consider interface here as coordination, communication and coordination. And to see that so many inputs are involved in our activities from different branches. Those all inputs must work together at one time. I cannot expect that something is missing and we can continue. For example, suppose some pipe, some conduit has not been laid. some conduit has not been laid in some parts which are going to pour, maybe column, maybe beam, maybe slab. If some electric pipe is not put in due to whatever reason, or missing, or some blockout is not framed in for HVAC duct. I'm just giving an example of this. Means if these are not done, or you may say in terms, in clear terms, inserts, which we call professionally, if INSERT inserts are not done, can we pour concrete? That's my point. If some other inserts are not done, can we close that flooring? We cannot do that. In services, inserts are very important. In services to buildings, in services that structures have to draw from or support, or device support, those inserts are must to be embedded or to be placed in prior to concrete is poured, because once concrete is poured, we cannot put inserts in. That's a failure, and that point we say a kind of coordination work, or these people call it interface, no problem. You can say interface of various disciplines, interfaces between materials, compatibilities, interfaces between people's connecting each other. You may call whatever material interfaces, or personal interfaces, or staff interfaces, whatever you can say. It means same thing, that materials should work together, electrical material with mechanical, HVAC or lift or something else, whatever equipment we place in or instrument we place in, these should work each other. Just like we say in 5G, machines should communicate with each other. It's not 5G I'm talking, just giving an example. Concept of 5G, how did it come? Just like we talk to each other, we interact with each other, we reciprocate with each other. They say machines should do same thing. Machines should do, equipment should do. If one equipment raises one question, other equipment must answer. And also it's called Internet of Things, like that you may say. Just like we say this is QR code, you just use this code and this message will go there. It's a kind of design interfaces. We talk about interface, so I can say interface is not something new. It is, you can say, agile management. Agile means I'm talking of agile as well as agile is not that much applicable to civil engineering, can say. We have to think of civil engineering one. So we may say lean, though we don't use it also, but term says it's lean, where we have complete organizational work in construction, and we benefit from that also, though its name only being given. We used to do it before, just like system, call it a system. It was name only that was given to system. We used to conduct all tests they require. There was no inefficiency in that. When there was no computer, there was nothing. We used to work also. We used to inform everything in that way, and there was no dearth in that. There was no loss in that. We had everything with us. As I give an example, when there was no calculator even, we used to work in engineering. We used to study without calculators. We used to do slide rules, calculations, and also log table. If you talk of log table, maybe some people now say, what do you mean by log table? But we use that one. I did not use slide rule. I'm not that old. There were people prior to me who used slide rule in engineering studies. So we can say here, when we talk of construction activities, they say that you have to understand techniques of lean. Okay, we understand techniques, but what's technique? They say master scheduler technique. Well, I don't think it's a technique, it's a practice. Means what technique? You can simply say in common life also, I want to buy something, it will cost that much. I want to take so many days for this buying. We usually do that. It's not a technique, it's an activity, I can say. Physical work we have to do, and we have to purchase something for that. It's a part of that. It's very common sense that if you want to do something, you have to buy some resource, you have to buy some material, and you have to hire someone who can work on that. For example, you want to do some plaster on wall if you are home, and you first say, oh, my plaster has deteriorated on this wall, I will do it again. So for that, you will need someone, some mason or some other person who is expert on that. And that person will say, first I must chip it, hackle it, all surface, and they will do that. And then make preparation for next new one. So you need what? You need tools for chipping, you need person to chip, you demarcate area of chipping, and you gradually do it because it's existing one. And of course, you have to then procure materials like sand, like cement, all that which are required for plastering. Then you have to do plastering on that, and then measure that one. This is what? It's interface. You have to rack joints, and people don't understand. You have to rack joints of block work. You rack joints on stone. They don't understand this interface because there's an interface connection between cement mortar that's already set and new mortar that's coming in. So if you chase in some existing mortar joints of in block work or brickwork, you will create bonding or key between old mortar and new mortar. So your plaster will be keyed in, but nobody does it. It's unfortunate. Nobody does it. Forget keying. Keying is one part, and we have to provide LEDs also. LEDs means expanded metal network, so that cracks are avoided in plaster. We don't use that also. So interface means not only for understanding what do you say. When I say master schedule, my master there in plastering repair is repair of plaster. How I do it, how much time I need it, and then it's a lot of work. You have to say, if you say he works for many years, then that project is say, I have to give three monthly program or quarterly program. Every time, every month, I have to give quarterly program, which will force me, which remind that you are due for this work, and you have before 1 month or 2 months that material which you are going to install in that or include in that, those activities must be available, and you must have placed the order for that. Place order as contractor or whoever is doing that. And those are, you can say, we can look ahead in that way. That program would tell you on this or that, or that program is read by whoever. That would say, I have to do this activity in this period, so I want this material ordered or approved. So this is look ahead. And also, this is for quarter year. I say no, every week I want, because I can't waste time just 2 hours a day without thinking. I must know what tomorrow I have to do. My people, my supports, my foreman, my general foreman, or my site engineer, when I'm saying project. I'm not saying myself. When I say I'm doing it, means project is talking. So that project expects those people deployed for this work that they read this project look ahead, and also weekly program. So those who are on site as consultant and those who are on site as execution people, they know what they have to do. They themselves plan a project. Leader plans or whosoever plans, but everybody should know, and that mind planning is known to everyone through that weekly program, which is very important. And then there are other programs in between these interfaces, you can say. So he says last planner that is weekly, and master schedule that is total, and also look ahead. These are three levels. You can say there are more levels in that. If you have 20 or 10 buildings or other components in a project, you have to make these three for all, or in combination of the master plan can be done for one whole project, while you can say there's another one that can give you second levels, that level 2 preparation for each component of that project. And that's point where we must understand, we must learn. That's important point. We can't leave it like that. So this is very clear concept of what we think about, what we have to think about, and that's I say is very important. We have to understand this point. So this is not simply reference to some paper. This is something to realize that we know it. This was given in 93 somewhere, but we did it before that. Same thing I raised in question in seminar. You are telling us about system, quality system. You're not telling us something we did not do before. Got my point. That visitor, that professor explained to us what is ISO 9000, how to deal with this, how to handle with this. Let me be back, please. Just a minute. I'll go up and come back. Excuse me for 5-10 minutes, because birds will be waiting for me. That I don't like somebody wait for me. I want to feed them and come back. Thanks. Okay, so I'm back here. So what I was talking was this. Maybe I'm not clear about this to many people, but I say challenges it is. Well, I don't consider such challenge. This may be lean or it may be whatever. I can't say it's challenge because we used to do it. They may have their own definitions, they may have their own explanations because now I'm talking about lean construction, which must have a close relationship with lean construction to work. You know, we can say if we are using that technique, they're saying physics of production, I'm saying physical production, I would say practical work, I could say the mechanical work, you can say activities, you may say. And how does it work? That's important means. And they say that difference is that pieces are related to each other, how pieces are related to each other and how are they connected. My question is, I'm talking of civil. In these pieces are produced. It's not question of how pieces are related. These are produced. This may produce either in factory or block or in brick laying. This is practically manufactured on site by concrete mixing. We use these materials on site, and particular concrete which is produced on site and included permanently for activities. We put in steel in that. So we cannot say that they are connected. Effect is connected when we produce RCC member. We can say produce beams or slabs or columns, completely framework. And these members work in unison. Beams and slabs, beams and columns and foundations, all these work as unit. They don't work as separate units, they work as integrated unit. This is theory, this is structure. My body works as whole unit. I cannot say if my mind is not working, my leg is working. If my heart is not working, my liver is working. We cannot say that. It is not assembly. It is not piece. It is complete body. It is complete unit. When we construct buildings, we construct bridges, we construct whatever, road. We cannot say that these are separate units and we have to assemble them. Yes, we can say for machines, for equipment, yes, these are assembled ones. There may be many parts in machine which are produced separately, designed separately, have separate properties. But they come within range of machine requirement. There are some parts which may work only for 6 months or 1 year or 2 years. And there are machine life which may be 20 years. So there is no concern in that part shall certainly yield that time when you put another part, because lifespan of both are different. Mechanical response to both are different. What a boom of crane gives, what long length it has, what its hydraulic pipe is, these are all different designs. We are using them. These make machine performer. But hydraulic pipe generally, you must have noted, of JVC or excavator of shovel or whatever, is many times broken. I have seen even these hydraulic pipes, oil pipes, these break in just a couple of weeks or sometimes in 3 days. Sometimes tire puncture, sometimes sparks breaks, sometimes machine cracks. It happens. That is different. But in civil engineering, this does not apply. You cannot say this beam is cracked, I will replace it. You cannot say this slab is locally damaged, no, you cannot say that. So what are interface attributes? As I saw, there is a difference. You may call them in civil construction coordinational attributes, and either in mechanical or other automobile industry or aeroplane industry or some you may call them interface attributes. Our attributes are unit based. Our attributes are body based. Our attributes are structural anatomy based. It's not something which they are trying to say. So what are appropriate operations and methods for handling interfaces which we have to handle by studying all drawings, all documents, all specifications, and whatever contracts there are. We have to deal accordingly. We cannot go in isolation. Isolation doesn't apply here. Unity applies there. Uniformity applies there. Actions apply here. That we have to understand. And what are responsibilities for involved parties? Both are there. In fact, in civil construction, it is material interface, it is material coordination, it is procedure interface, it is procedure coordination, and it is human interface, it's mind interface, it's requirement interface, it's provisions interface. There are so many interfaces, or we can say coordination. Every requirement must stand together on same level to talk to each other. If something is missed, coordination is defective, it missed. You have to understand this point. For example, if I forget certain bars in steel and I pour concrete, what is solution? I say forget some bars to place in, nobody cared. It might be shown in drawing, I did not care. But we poured. We cannot say just take it out or put in. How can you take it out if it is more than required? And how can you put it if it's not put in? It is fall short, it is defect. That defect rectification does not exist. We have to understand this point very well, that there is a difference in civil construction and other construction. Civil construction, because it is durable, it goes to 50 to 200 years to 150 years to 200 years consideration, while no other construction works that lengthy. Your car is broken in 5 years and you say, okay, I dispose it. Your bus, same thing. Your airplane also has some life. Road too can be changed in 10 years, 20 years. But concrete work, building work, structural work, flyover work, this can't be changed in a period of 50 or 100 years. There are so many buildings that have been working for centuries. We did not change them. So there is a difference of lean and agile. Well, I take into my consideration, I combine these two and say this is my coordination, this is my interface. Because my interface is not like your interface, it's different. I have to sit day and night on my drawings, on my specifications, on my details, on requirements, on whatever else I have, and then think on how to combine them. And how to combine them means how to coordinate with them. I should not be something and also think that something is missing. And if something is missing, I have to demand for that. That's what it's coordination about. But it happens only when we concentrate, when we sit, when we talk to each other. It may be interdiscipline or within discipline. When it comes to question of air conditioning or electrical work or HVAC work or lift work or mechanical work or some machine where foundation is involved, and we have to sit together with those interdisciplinary people and confer on that. So that can be called both a combination of lean and agile, because civil is involved. Civil is not dependent on agile or on you can say interface of agile, or you can say that's what we call it. I forget again. My memory is very weak actually. Yes, lean. We are not saying my physical work is different than my soul work. My soul is civil engineering soul. And there was an interesting comment on Facebook. I saw someone commented about a civil engineer that you're looking like a guru. In fact, that engineer had some tick on head, and he means people considered maybe the guru or a spiritual leader. But I enjoyed this comment and responded, yes, you're right, because civil engineer is spiritual as far as work is concerned. Because spiritualism means you have to imagine something, but to conceive something. Only then you can define that. When we imagine God statue, we can define that. Otherwise, it's difficult to define if you don't consider some picture. In some picture, you can define anything. Artist defines this clouds, this trees, this rain, and this. The artist defines according to artist's concept. Here we define according to professional concept. We have to imagine some structure, and we not only imagine it, we can't just put it in the papers and say, okay, see my imagination, this is an art. No, this is not an art. This was an art when you claimed it from you pulled it out from your imaginary picture. Now you have to design to construct it is then physical work. So, civil engineer has to start like a spiritual person, and he has to go to rationalized person. So there's a spirituality and there is rationality. When it is spirituality is imagination or concept, and that comes to point of realization, that is rationality, you have to design in a rational way. How can you do it? From whole to part or part to whole? I think it's not possible in civil engineering to produce something from parts to whole. In civil engineering, we call it whole to part, just like God designs from whole to part. God never designs something from part to whole. God never says, I have designed hand of this person, I have designed legs of this person, I have designed stomach of this person, heart of this person, or this of this and that. And I'm not going to combine them. No, this doesn't happen. In medical world, in universe, body to body, whole body to part is a professional design there that works and that has been working. That's why I'm saying professional design, not because of money, because of working, because of success. It's called professional work. Our body is based on professional design. And then we say in our planning, work breakdown structure. Work breakdown structure. And what is work breakdown structure in our body? All parts, how they work. They work in unison. They work together. They don't work just for 1 week or 2 weeks. They work forever. So there is no classification for them. You got my point. Our body is a perfect civil engineering example. Though it's not civil engineering, I'm saying perfect civil engineering example. Work of sun, work of solar system, work of universe. These all are civil engineering examples because they work comprehensively. They continue to work for long duration. They never stop. They never take any rest. They never apply for application. They never apply for vacation. They never go anywhere. There's no guest for them. There's no relative for them. They keep on working. Nature gives us a lesson every day, every moment. It's a student that has to receive it. Teacher is nature. You don't ask your teacher. Teacher doesn't reply. If you ask your teacher, you'll get an answer. So that's what I say. Civil engineering is different. It is distinguished field because it is concept of origin of universe. Still, I think many times, how could God construct this universe? And I don't know how many universes do exist in addition to this earth and this solar system. This breakdown of structure, I don't know. I don't know this work breakdown. I don't know breakdown of body. I don't know breakdown of earth. I don't know breakdown of other planets because I am not that much knowledgeable. I don't have access to all that knowledge. Breakdown actually means a kind of analysis. You try to understand why I'm saying that. And I say work breakdown structure, what does it mean? This work you have to do, how you have to do, you have to know. If you have to do some activity, it's one part, but if you have to do object, that's this building, this project, that project. What is that project? You have to know it because you are engineer or qualified for that. It's a job. So you define work breakdown structures. You consider there are so many works or activities in that. There may be 150 activities, 200 activities, 500 activities, and each building have different activities. So you just put it on paper, this activity, you put all activities that you expect there would be. As an engineer, you expect that, and that would be there. That's the point of approach, means those activities must be there. And when you do all these activities, you think of all this, you put in paper, in sequence, and then you say, this is master schedule, this is master plan, this is second level, and I'm giving these activities separately so that these fit into this master plan, and that's whole master plan. There's one component, there's another component, and then you separately group them in separate components and sub master plans for them, level 2 master plan for them. So we say this work breakdown structures. And just like our body has every work, heart is working, mind is working, nose is working, mouth is working, teeth are working, tongue is working, liver is working, heart is working, chest is working, blood is working, and what is not working? Discharge working, everything is working. So these are all breakdown structures, but we can't break them in reality, break them in physical world for purpose of construction, but in the spiritual world this is not breakable. It's only understandable, so it should be work understandable structures. Work analytical structure. We have to analyze, and analysis is root of engineering, just like thinking is root of analysis. So analysis is root of engineering, and this is done only in engineering, nowhere else. Analysis is done only in engineering. That is beauty of engineering. Analysis means to know facts of each and everything. That's called analysis. Whatever exists, they are here to know. And those who do analysis, they are mathematicians. They do calculus work. They do, you can say, chartered accountancy to some extent. They also do some extent law. But those are not perfect. In construction and civil engineering, in designs, everywhere you have to calculate. All forces you have to calculate. And those can be calculated only based on understanding of whole building or whole structure. And once you understand whole structure, then you understand every part of structure, and that's where you can say it is design work. But don't forget that design is later on. First it is universe, it is natural material, it is understanding of material, it's mind of people. Then you can say, yeah, this exists. So breakdown is that I try to explain you in completely different manner what is breakdown, and this is very much important, and we cannot avoid this. If we can understand these points, we can do a lot. Interface and coordination are very integrated terms. These can't be separated together as far as engineering is concerned. And now what it says in conclusion, let us see. Lean construction and agile project management, two main representatives of recently emerging management. This is long back anyhow, it's not now. The philosophies we have to understand, being gradually accepted and implemented by construction industry, though both are then combined. So although their implementations have achieved great progress, difficulties and challenges are apparent. These two philosophies are both considering project complexity to some extent. However, none of them puts the main focus on interface issues as an integral part of project, because we have different types of coordination. Actually, some lean and agile applications increase project complexity to a great extent, such as complex relationships and intensive collaborations among small teams, as well as constant changes. Interface can be regarded as a facilitator when coping with project complexity, and furthermore enables a smooth application for lean construction and APM. Just pointing to here, that means management or the interface has been drawing more and more attention from both industry and academia. This is natural means. So we have to understand this lean construction and APM. Lean, I think, though it's lean, but it allows construction to go on practically. And we say agile with human dynamics and achieving, we can do with that. Efficiency we can take out of that. If you forget all this, you take care of farming personnel, farming professional, agriculturists, you can say, inundators, you can say. They understand their subject more than scientists understand, more than agricultural engineers can understand. Those people understand, they know how they work. That's what I'm saying. It's a very important part. So I'll keep close interface management now. I'll go to role of site engineer and You may say detailed engineering. Let us see. First of all, I repeat this. Page by page, I do it, so we can understand very well. Just a minute. I put my on again, 71% remaining. So it's a question of risk. So I should. My battery is also. So we can now move on. We can move on like this, and let's see how much you can do. So in this we were related to detail engineering requirements and site preparation, and we also were related to landscape, hard landscape, underground facilities. This could not be clearly done last time, unfortunately, and also I think there's another file which could not be done last time. That was, let me see, I think it is 6, and management is there, not as something else. Let's see, my 6th file I find this one. Which file is that? Well, let me finish this first of all. In this talk of feed 4, we talked of feed which we will and say that contracts verify process engineering works. Contractors shall during bid stage verify whatever is required, must verify process engineering work performed by feed consultant, and then contract shall bid on design based on that feed, and that design shall be done based on these details of feed. And feed is very important part of design engineering and pre-design engineering. Actually, when we say feed, this means it's feed and not that feed which you think is feed. It's not feed in, something like that, in adversarial form, something else. This is not a verb. This is, you can say, feed. This abbreviation of very big issue, and that is FEED, which we say that is this front end engineering design. You know it very well. Front end and deliver end. You can say when we conceive something in designs, just like I said, imagination or a civil engineer, which is spiritual work, where analysis is not done in mind. In that issue, when we say feed something, a kind of vision it is, vision, a description of dream it is, a description of some project it is, based on no analysis, just a comprehensive way that your spiritual power of mind, or you can say irrational power of mind. Do you understand what I am saying? There are two powers in mind. If you just have interest in that, I'll let you know. And this is scientifically oriented. This is not what I see or you think. It's understood medically as well that our head, our brain, in fact not head, is divided into, is sphere actually. It is divided into two spheres, hemispheres, or section of that. If you take of that head, that has two subsections. One section is on left and one section is on right. Hemisphere they call it. These two hemispheres work in our mind, our brain. When we take, one is left hemisphere and one is right hemisphere, this is what is considered. And this is physical being, and of course when it's physical means soul must work there. It's understood that left and right are connected to cross arms. Left hemisphere is connected in work to right hand or right arm, and right hemisphere is connected to left arm. So this is a Caesar type situation. Caesar means it works like a Caesar, and your power of left hemisphere that is used by right arm, and power of right hemisphere is used by left arm. Or physically, if you take by experience, generally I'm saying right arm, right hand is used for rational work, is used for executive work. And people do say, oh, I use my right hand, I work. But they forget that this right hand is not your thinker. There is someone else thinking behind your right hand. Same way there is no thinker in left arm. Somebody is thinking in right hemisphere. So what we say, if we take question of left arm, how contribution we get, what contribution we get from left arm into our work, we say that is non-logical power of information that you extract using your left hand, left arm to your right hemisphere, that is known as irrational. Means there is no explanation, there is no logic, there is no justification, but you have answer. You can say imagination. Your right hand tells you what God wants to do, what is dream, what is imagination. But when you go to right arm or left hemisphere, you will stand in rational world. You will say, yes, this is logical. There's a reason behind this. You will try to elaborate everything. This way, left hemisphere is rational, logical, explainable, justification giver, and other one is irrational. But both are important. Until you imagine something, until you dream something, you cannot do anything. It may be your dream, or it may be others' dream you are going to do. Your own dream is more important, because you are not only author of that, you are exponent of that. It was imponent in God's department, but when it comes to your department, you become exponent of that. God gave you something which you are exposing to world, and that's why you are called exponent. You are end of exponent. And once you exponent, you are exponent, then you have to start justification on that. You have to start thinking on that. You have to start applying mind on that. And that is rational activity. That is activity that your left hemisphere would do. This is what I think is about. So when I say feed, I wanted to give you an example of this left and right hemispheres because I have to explain feed. Feed also starts with that kind of right hemisphere activity. It gives you an input. It doesn't give you analysis. It doesn't give you calculation. It just tell you what project wants. What this project which we are going to do, what it demands. That gives an input of that. Or in dream, it takes you into dream world. We are going to do this. And you start with that. We write philosophy of our project. Why we did start this? What was reason? Means a philosophy in an expressed way that a person who is going to design can understand our mind. Because you cannot physically explain something to other person. It's not possible. Interaction can be done, but not text contents. So you have to think of philosophy, why it was economical backing, it was something else, it was defensive backing, or it was enrichment of some existing philosophy, you may say. And why is this required? So that stage we start something. We can say this was reason that we are going to take up this project. And because this project shall be this level performer, we have to do that level job. Then we have to think of that. We have to keep sequences in and start constructing feed. So feed says this is purpose of this project. This we want to say start like this and this end like this. And what stages we are going to do in that design work. Which theory we have to apply. Which formula we may apply or may not apply. What is the function of this project? What's the intermediary work of this project? How many years this may be there? How many changes it will say? What level of hysteresis, loss of value you get in it? That way, it depends. It does. But design doesn't take many years. Design may take 6 months, 1 year, 2 years, depending on size of project. How many formulas are involved, how many calculations are involved, how many analysis are involved, and then designing, detailing are involved. So that is job of feed. It is like, start design, start original design, not copy paste. That is feed. You have to feed yourself for others. You have to think of yourself for others so that they don't waste time in thinking but in working. That's the point here. I have to say I save time for those designers who work for me for project, not for me personally. That is very important point. We have to consider ourselves. So when I say design is second part. First part is input to design. This input which we give to designer through feed. I don't know if people understand this or not. But there may be 20 formula for one solution. We'll take best one, easiest one, and which is more reliable than others. We have to define various categories of designs required. We have to define what existing history of this site is and which is best way. What we define is scope of object, scope of project, and scope of design. Both we have to decide. We have to decide that. It may take time. It may be dependent on interaction among various people. But you can say outline of philosophy of design and requirements that it will meet. And those requirements which have to be met, all must be described in feed. It must be described which level of design we have to do, what reliability of your design should be. Those must be defined. And once these are defined in clear terms and feet, then it will be easy for designers, engineering and architecture others to reach to suitable or acceptable closure or conclusion of those proposals, those offers. You have to understand feed like that. And when it is clear, feed is clear to everybody, and particularly to contractor who has to offer price for that. It may be lump sum price or it may be item rate price, whatever, lump sum fixed price. It shall be easy for contractor to work on that, how to work out price of that, rather than complaining in future. I was not given this facility, this privilege. EPC contractor is very big, always big in a sense that EPC means one has to know every aspect of project. You have to know every aspect of project. And if you are not able to know that, then your engineering is incomplete. I can simply say engineering is incomplete. Contract is unable to give you price. You are unable to understand contract, or you are not able to devise contract. You only understand technicalities. It shall be a problem. So we have to take into comprehension completely our project, just like we expect completely a sound baby. We expect completely a sound mind. Until I have sound mind, I cannot use my mind. I may be called, slow thinking person or mandabuddhi. You may say that. Sound mind is very important for engineers and all professionals. Sound mind tells you what is right, what is wrong. Sound mind tells you what is required, what's not required. If I am going to detail out some project, I must be comprehensive of that. I'm not saying I should know everything, but refer to everything. That reference must be known. Or you may say, I may be like an anchor, though anchor doesn't fit in here. You may say coordinator. Coordinator is an anchor in papers. That's an important point. In writing in papers and documents, it's my choice. It's my proposal. I have tried into my consideration this theory, that theory. I have decided that I have to put everything in the closure, or you have to let in homes owners sleep in better position, in better location, and youth can be adjusted anywhere. If you have that knowledge, if you have the comprehension, if I understand, maybe first time it doesn't come to me, then I try second time, and even then I fail, then we have to try third time, sure. In third time you shall get results, not only results but also mistakes that could be done, could be avoided, and we have to take those points as very important one. Modification, revisions to whatever details we give, these are important because contractor must be facilitated with complete details so that it would be easy for bidder to analyze everything and price. We should not be happy that if contractor has caused some error and quoted lesser price than was required, it's your duty at that time that provider. That's why we say whatever details we show, whatever data we use, whatever we do, it should be in consonance to requirements. Mechanically, it may be there is a piping and instrumentation diagram, or in civil it may be structural details, it may be architectural details, or whatever sorts of details. Everything should be clearly depicted and not be left to site decision maker. Should not be that. So what I did in field yesterday, I explained all this, and I'm just trying to refresh what we did. This is a very important part that we said steady state hydraulic study we did, in which steady state means, if you just go through that, you'll find the contractor shall carry out hydraulic modeling and study based on final cooling water network or whole project using latest pipe net. So this is something hydraulical calculation we have to do, and we have to find interesting answers. It's a very important point that once you are contractor of mechanical work, piping work, you have to define route. You have to define route in simulations and in agreement. Sure. So everything should be crystal clear for when you are working as a contractor. You are not interested in theory and designs or in wardrobes. You must be interested in complete overhaul. Complete. Rates are with contractors, flow rates are with contractors. When I say flow rates, discharge rates from pipes, and everything must be considered. Contractor, if it's in design, is to define which routes to follow and whether or not this route is in compliance to contract mandate route. All this require designs. In case there are marked differences between routings used in simulations and actual, this should be correctly discussed. Layout should be correctly done, and this should not be invalidated. If required, conference should be done. Specifications and requirements must be checked. So there are so many issues we have to take care of that. I should not go into details of that. I'm just trying to refresh. Says that in case there are marked differences between routings, simulations, and actual layout during detailed engineering to an extent that the hatch shall invalidate hydraulic results and conclusions, then contractor shall carry out new updated simulations based on flow rate defined by company organization for individual consumers. Contractor shall optimize pipeline sizing, satisfies all operating and maintenance scenario. Soft copy can be provided to contractor, and contractor shall provide access to pipe network simulation program for company, and contractor shall determine allowable maximum water flow in network and propose engineering and operation solution to maintain higher flow in network piping system, and to highlight consequences of not adhering to this requirement. For selected and approved cases only, contractor shall carry out thorough and detailed hydraulic surge analysis. Stress analysis called also surge analysis of entire cooling water system to determine its adverse effects on system, that is water hammer formation, undue stresses imposition on connected equipment and on pipe line supports equipment. Based on hydraulic transient analysis, contractor shall determine and provide required protection measures such as provisions of vacuum breaker and specify required valves closure time. Contractor to note that during field transient analysis of return cooling water network related to stress recirculation system has not been done due to non-availability of data for cooling water pumps or cooling towers. Contractors shall obtain all necessary data in we have to verify much in dynamic simulations. Dynamic simulations. Verify operation ability, I should say, rather than operability. This is a short term English form. Controllability, control liability. Dynamic simulation studies shall be conducted by contractor for following objectives. Operability, this dynamic one. Okay, so what you have to consider in this case is dynamic simulation studies shall be conducted by contractor for following objectives. Confirm startup procedures. Startup. Startup, cost down, emergencies and operational transients. Says confirm startup procedures. Startup Confirm shutdown procedures. This is a big thing. Confirm startup and shutdown. Confirm design requirements for vacuum breakers. Confirm design requirement for vacuum breakers. Confirm closure time for valves. Confirm to restart procedures. Copy of models shall be provided to company client during course of detailed engineering. Contractor shall provide access to pipenet simulation program and also company client process engineers. Now, if contractor intends to carry out transient analysis, its own in-house expertise, this must be approved by company or client prior to start of work. Then there are some systems in this which we have to think of, and these are, you can say, electrochlorination system, utility system, process flow diagram, utility flow diagram, piping and instrument diagrams, and you can say then let's go a little behind that. Electrochlorination system. What is that? Now, contractor carries out detailed hydraulic analysis and designs for chlorination system, including distribution system, and generate, update all necessary drawings, documents. Contractor shall carry out aforementioned scope of work suitable for continuous operation and shock dosing modes. Contractor shall also design for chlorine discharge monitoring system. Utility system. Contractor shall verify design and capacity of utility systems as instrumentaire, plantaire, service water. Instrumentaire. So many instruments are there, they are connected, air water supply, plantaire, and service water. These are various systems, very complicated one, you have to understand, not my field actually, but I'm just trying to coordinate information. Process flow diagram. Contractor shall perform all work necessary to verify, correct, or revise process flow diagrams, heat and material balances to reflect changes in design made as a result of contractor's work. Utility flow diagrams, UFD. Contractors shall perform all work necessary to verify, correct, or revise utility flow diagrams and heat and material balances to reflect requirements of process and utility designs, which shall be approved by company client. Piping and instrument diagrams. Contractor shall review, fully update and develop process, utilities and electrochlorination P&ID provided in feed design package during detailed engineering. All feed holes on P&ID. All feed holes on P&ID shall be investigated appropriately and reviewed by contractor. Further development of diagrams shall include but not be limited to finalizing all line sizes, including details of control valves, vacuum breakers, and etc. Adding or cover correcting mechanical, electrical, and instrument details resulting from detailed engineering and adding random details. Contractor shall implement an action items identified in field hazard operation as a part of contractor responsibility. Further, contractor shall ensure that all hazard actions have been closed out and auxiliary piping and instrumentation diagram required, like for pumps protection or cooling off the resistors of variable speed drives utilizing deionized water shall be developed by contractor or obtained through equipment suppliers vendors. All valves including manual gear operated valves shall be tagged. Contractor shall fully develop detailed piping and instrumentation diagrams for phase and ultimate phase and update these drawings during course of EPIC as required. All proposed additions and modifications, all proposed addition or modifications means that all proposed additional modifications to piping and IDs by contractor that may jeopardize or compromise currently built-in operating reliability and or flexibility shall be rejected. Contractor shall then rectify, modify, design and P&IDs to company clients' satisfaction at no cost to company client. Should there be discovered a conflict between P&IDs as developed and company client specifications, farmers shall prevail. It's understood and accepted that P&IDs may see many revisions during detailed engineering stage and even during network construction. Every revision shall require company client review and approval. I should say upon successful network commissioning, a full set of as built P&ID be prepared and submitted to company client for review and final approval and acceptance. Line list. Contractor shall review and fully update line list based on results of detailed engineering. Process and IDs, process piping and IDs and instruments. Let me see if I can show you something here. Hold on please. Maybe I can see something I can find here. Piping and instrumentation piping. just got you this information from one website, and we have to just think on this. How can we use this? What are piping says? What are piping and instrumentation diagrams? Some information on this. What are these diagrams? And it says, I'm new to P&ID. I want to learn more. So it's all that. So it says, what is P&ID? That's my question. A piping and instrumentation diagram, or P&ID, shows piping and related components. A piping and instrumentation diagram of a physical process flow is most commonly used. Another is here. Has to flare and accumulator, it comes back. It's technical. So here is feed coming in, there is steam, here is condensate going out, and you can go and see function and purpose of PINDs. PINDs, you can say PINDs. P and I